Hi and welcome to my channel. This is Dr. Rajiv Varshe. Today we'll be talking about the diagnostic algorithm of headache and face pain. This is a complex topic and it is difficult to cover the whole topic as such in this one particular video, but then I have tried, or rather made an attempt to simplify it to some extent, and I believe that should help with the clinician who is working in pain management. This is essentially targeted to the students of pain management who are anesthetists and trying to learn pain management. Okay, so let's begin with the topic, diagnostic algorithm of headache and face pain. Now, when you come across a patient with complaint of either face pain or headache, bilateral or unilateral, with or without the neck pain, then there are certain basic questions you must ask, and that will segregate the group of diagnosis. For example, if patient has sympathetic symptoms also. What do you mean by sympathetic symptoms? If there is a lacrimation plus nasal discharge plus redness of the eye, these are sympathetic symptoms. So there the diagnosis will be few dedicated diagnosis like SUNCT, SUNCT, or paroxysmal hemicrania, or hemicrania continua, or cluster. All right. But if those symptoms are not there, then the diagnosis, set of diagnosis is different. So let's first start the topic. So when you see a patient, the first question that should come to your mind is the pain unilateral or bilateral? Now, if it is unilateral, then you ask whether there are sympathetic symptoms, which I said, redness of the eye, or nasal discharge, or lacrimation, red eye, and congestion, right? So these are all symptoms of sympathetic activity. If that is there, then you have to think of SUNCT, 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 cluster headache, paroxysmal hemicranial pain, or hemicrania continua. These are the common diagnoses. Okay. Now, how do you differentiate these four? When you talked about SUNCT, it is a sudden, right? So very frequent, like every 3-4 minutes, the pain comes repeatedly, and the severity is very high. It is unilateral with sympathetic symptoms. So that is SUNCT. Paroxysmal hemicranial pain. Now, paroxysmal is episodic. So the same kind of symptoms, but episodic with little, interval between the pain. Then probably we are dealing with paroxysmal hemicranial pain. Okay, and if it is a continuous hemicranial pain with severe sympathetic symptoms, you have to consider the hemicrania continua. As regards cluster headache is typical. It's essentially around the eye, and it goes on for 7 days continuously. There's a cluster of days in which this type of symptoms are felt. So this, we are talking about the headache with sympathetic symptoms, unilateral headache with sympathetic symptoms. Well, now if the sympathetic systems are not there, then there are a set of other diagnoses. First of all is migraine. Now, if it is a migraine, usually it is unilateral. One. Second, usually it is a mid-age female, usually, not necessarily. They will have aura. What do you mean by aura? They will have typical some visual disturbances or different smell or different taste before the pain comes. That's typical of migraine. Of course, migraine itself is a big topic and there are variants of migraine, but I am talking about a broad thing. Like if these patients have these kind of symptoms, you have to consider migraine, unilateral with these kind of symptoms. All right. So first thing is migraine. Second thing is trigeminal neuralgia. In trigeminal neuralgia, depending on it is V3, that is the jaw pain, or V2, that is the pain besides the nose and below the eye, and V1, that is the pain above the eye. Okay, so there are three branches of trigeminal: V1 going above the eye, V2 going below the eye, and V3 coming to the mandible. So if a patient has electric current like pain, episodic, and patient has pain on speaking, pain on eating, pain on deglutition, at times even the wind touches and patient has pain, and in advanced cases even touch causes pain. All right, this is typical, and pain is current like. So that is trigeminal neuralgia pain. All right. So we talked about migraine, we talked about trigeminal neuralgia. Now coming to the TMJ pain, that is temporomandibular joint. In case of temporomandibular joint pain, patient will typically say that patient gets pain while eating and there is a tenderness just in front of the tracheus. Okay, so here you can see the tenderness, and when the patient moves the jaw, patient gets the pain. So that is TMJ pain. Okay, now TMJ, trigeminal, migraine. Then the most important is nasal, ocular and dental vision. What is that? If patient has got any dental problem, then also you will have unilateral pain, right? Caries or any kind of dental issue. But then typically the history will be, it starts with dental and remain there. The tooth will be tender and pain will not be trigeminal like or sympathetic like, right? So dental is very clear. You take the history and you know. Similarly nasal, if there is a sinusitis, one will always say either unilateral or bilateral tenderness of the maxilla. Okay, running of nose. He will have other constitutional symptoms. Similar ocular, patient may say that if he reads more or if he has to read from a distance, then he gets those kind of headache. Or patient might have intraocular raised tension. So redness of the eye will be there. Other symptoms will be there. These are also reasons. So ocular reason, nasal reasons, dental reason, TMJ, trigeminal, migraine, okay, temporal arteritis. Now, what is temporal arteritis? The temporal artery, which is in front of the ear and it goes in the temporal area, in an elderly female, this artery may get inflamed. And it is a part of a rheumatic complaint all over the body. Polymyalgia rheumatica may be there. Constitutional symptoms will be there. The artery will be tender and the pain will be pulsatile, typical. This is temporal arteritis seen in elderly female. All right. So that is temporal arteritis. Now post-herpetic neuralgia pain. History will be there. If the patient has got history of herpes and there is a single nerve or double nerve area which is typically involved and patient has got PHN like symptoms, then you know that it is a post-herpetic neuralgia of the face. And post-stroke pain. Patients who have got stroke, later on they might develop unilateral headache. But then again, there will be history of stroke. There will be other sensory motor disturbances, same side or other side of the body. So that also makes it very easy to diagnose, right? Now think of a bilateral pain. We talked about unilateral pain. Considering bilateral pain, if patient says there is a pain on both sides, then what do you think? Again, ocular, dental and nasal, these reasons will be there. They can be there. So in dental bilateral, you can have, in sinusitis, you can have bilateral pain. In ocular, like if there is a spectacle problem, the vision problem, he will have bilateral pain. So these are the most common things. And remember, think about common things first, then think about uncommon things. Now, another is tension type headache. Now, what is tension type headache? It is not like, I got tensed and I got stressed and I got pain. No. There is a spasm of the muscle, there is a tension in the muscle, essentially the temporal muscles, and patient gets band-like pain. That is tension type headache. Alright. And it responds beautifully to indomethacin. So that is typical of tension type headache. Then comes a medication overuse headache. In some patients who have taken some medicines for a long period of time, and you see that there are no other obvious reasons and still patient says there is a frequent headache, you might as well consider that medications can be responsible for headache. Then one thing which is not mentioned anywhere but we have seen in clinical practice is those patients who have got hyperacidity, gas symptoms. They always tend to have headache. Once they throw out, they feel better. You just give pantoprazole and paracetamol, they feel better. So these are the common diagnoses which you think first before going to any sinister diagnosis. Well, what are the other reasons which we have not covered in this particular discussion as of now is occipital neuralgia. In occipital neuralgia, pain will be essentially on the back of the head. It will be current like going on one side of the head on the back side, right? It will be current like, and there will be tenderness of the occipital nerve behind. Then comes glossopharyngeal nerve neuralgia. In glossopharyngeal neuralgia, pain will be in the ear, below the ear and in the throat. And it will be more on deglutition. It won't be on speaking. There will not be current like pain on the face. So that differentiates it from trigeminal. The glossopharyngeal neuralgia pain can be neuralgic, but essentially it is in the ear, beneath the ear, and in the throat, right? So that is glossopharyngeal neuralgia. Then something, there is a diagnosis, something called burning mouth syndrome. Patients frequently say, nothing is problematic, but my mouth burns. Usually these are systemic disease patients, vitamin deficiencies, other systemic diseases, or even GI disturbances, even GERD patients, they have these kind of symptoms. And then, not to forget, the sinister intracranial regions. If there is a ICP raised, then you will have headache. But see, we are talking about chronic headache. But even in chronic headache, patient may have ICP raised, or patient may have other intracranial regions. In that case, there will be some lateralizing signs, there will be some other history, there will be constitutional symptoms which will be there. So considering all these factors, we have to come to diagnosis in patients of headache and facial pain. This time I have changed the format of my lecture because there was a feedback from somebody that at times the PPT is becoming boring to us to understand. So I thought, let me do it this way. And please put your comments in the comment box here whether you have liked this pattern or not. Thank you very much. We'll see you again in the next video. Thanks. If you liked it, please share it. Thank you very much.